Welcome back. It's Thursday, and that means a house call from our very own KRDO News Channel 13 doctor, Dr. John Torres. Dr. John, how are you this afternoon?
I'm doing great. How are you guys doing today?
Good, thank you.
Doing well. Dr. John joining us via Skype today. And first off, Dr. John, we want to ask you the latest on the measles epidemic.
Yeah, the measles epidemic, it keeps spreading. It's 17 states now. It keeps going on. And, this is one of those things that even right now in some different parts of the country, there have been a lot of cases of people with the measles doing some trips, traveling, exposing a lot of people. That just happened around San Francisco. But even locally here, more important, with a different disease, the Colorado Department of Public Health and Environment just came out with new findings showing that this year we had more flu hospitalizations than any year since they've been recording it. And so again, it's just a reminder that, not only are these vaccinations important, but sometimes the vaccinations aren't nearly enough. So we all have to make sure we protect ourselves, a lot of hand washing, and on top of that, make sure that if you do start feeling sick, you go see your doctor.
Wow, and what are you seeing now as far as flu cases?
We're not seeing much flu, although this last week at Premier Urgent Care, we did see a couple of cases. And so again, this is a reminder that the flu is year-round now. It used to be just wintertime, but now it's going year-round. So it's really never too late to get that vaccine.
All right, well, there's a new study that says being overweight may not be entirely our fault.
Right, it's one of those things that's saying it's not entirely our fault, but your own choices can certainly add to the weight. This study is out of the University of Michigan, and their researchers look for genes that could regulate our human body size and shape, in other words, our weight. The study shows that the genes played a role in the weight and where the fat gets stored in the body, which is probably more important. Now, this was a huge study. Over 500,000 people were sampled, and it turns out that there are more than 100 places in your genes, inside our genes in our body, that play a role in obesity traits. So no single gene leads to a person being overweight, but the findings could lead for new ways for treating obesity. But again, this is not an excuse. This is not one of those, it's all in my genes. This is basically just a message saying that's part of the issue. It's a very complicated issue, and we need to look at all those parts.
Yeah, and Dr. John, obviously obesity is a major concern throughout the medical community.
It is, and it's one of those things that, with 30% of people here in the United States and a lot of countries around the world being obese or overweight, it's taking its toll on our health and our bodies, and so that's one of those things we just really need to, try and get a good handle on.
All right, Dr. John, well, as we saw earlier, there was that cute dog in Iowa who walked a great distance to see its owner in a hospital, and we know that people and their pets, they have that close bond, but now we know that they can tell what you're thinking.
It's pretty impressive because it might not be exactly what we're thinking, but they know what we're thinking because of our facial expressions. They could recognize those facial expressions. Researchers showed a group of dogs pictures of smiling and some angry faces. The dogs were rewarded if they managed to correctly identify the emotion behind the expression. In other words, were they happy, were they angry? They found that dogs can apparently distinguish happy faces from angry faces based on that expression alone. So whether or not they actually understand what these expressions mean, we're not too sure about that. But it could suggest that our pet's ability to figure out our mood may not be so far-fetched after all. And if you've owned a dog, when you come home, if you're in a bad mood, they know you're in a bad mood. If you're in a great mood, they start playing with you.
So your dog knows when the Cowboys lose on Sunday, then? Is that what you're telling us?
they do know that.
Well, Saturday, Dr. John, Valentine's Day, of course. So there's evidence that Valentine's Day can actually be good for you.
It can be good for you, but again, moderation is the key. What we're talking about. You've got the chocolate, that's good for you, at least dark chocolate. You've got red wine, which can be good for you in moderation. And of course, you've got love, which is proven to be good for you time and time again. Researchers at the University of Texas looked at different kinds of relationships, and they have found that love can do amazing things. Now, believe it or not, love can help prevent plaque from building up in our arteries, giving us heart disease, and it can protect against that heart disease. It can reduce levels of stress chemicals in our body, which of course can damage the immune system, and it can actually lengthen your life. These results have been tested in several settings around the world, so it's not something unique to us or different parts of the world. And researchers think that the personal contact turns on part of the nervous system, and that has a calming effect and cuts down on stress chemicals that are released in our bodies, and that can help us overall.
Very interesting.
Yeah, so I think what people want to know, Dr. John, do you tell Mrs. Dr. John about all this research and all this stuff that's been done?
Mrs. Dr. John.
I'm going to, you bet.
It's awesome. So eat a lot of chocolate, drink a lot of wine, that's what I heard.
Dark chocolate, right, Dr. John?
Dark chocolate, wine, and of course the one you love.
And moderation, of course. Everything in moderation.
There you go.
Thanks so much, Dr. John.
Thanks for joining us, Dr. John. We'll see you.